Good afternoon. Welcome to the fiscal year 19 Justice and Mental Health Collaboration Program Solicitation webinar. We're so happy that you're interested in applying for a Justice and Mental Health Collaboration Program, or JMHCP grant. We'll have several speakers on the webinar today. Joining us is Maria Fryer, who's the Justice, Mental Health, and Substance Abuse Policy Analyst and leads the Justice and Mental Health Collaboration Program portfolio. She is with the Department of Justice's Bureau of Justice Assistance. I am Sarah Wurzburg. I'm a Deputy Program Director of Behavioral Health for the Council of State Governments Justice Center, and I oversee the training and technical assistance for this grant program. Unfortunately, Nikisha Love, who's the State Policy Advisor for Justice and Mental Health Collaboration at the Department of Justice in the Bureau of Justice Assistance, is unable to join us today. I am going to run through the slides that were provided by her department, and if there are any follow-up questions on those, we'll make sure they get directly to Nikisha. On this webinar, we're going to tell you a little bit about the Justice and Mental Health Collaboration Program grant program. We're going to also provide some additional information on the award. Then we'll talk about the budget and review criteria. This will include some tips on what you should think about while developing your application on the budget side. And then following that, we will have time for questions and answers. If you have any questions, feel free to use the chat box on the lower right-hand corner. We're going to collect all those questions, and after the webinar, we will make sure that at the end of the webinar, we'll make sure that we answer those questions. I'm going to turn it over to Maria to talk about the Bureau of Justice Assistance.
Thanks so much, Sarah. I appreciate it. And good afternoon, everyone. My name is Maria Fryer, and I'm a policy advisor for the Substance Abuse and Mental Health portfolio in the policy office at the Bureau of Justice Assistance, or commonly known as BJA. And at BJA, our mission is to help to make American communities safer by strengthening the nation's criminal justice system. Its grants, training, and technical assistance and policy development services provide state, local, and tribal governments with the cutting-edge tools and best practices they need to reduce violent and drug-related crime, support law enforcement, and combat victimization. Thank you for joining the webinar on the fiscal year 2019 Justice and Mental Health Collaboration Program Solicitation. We look forward to providing you information and reviewing your grant application. I will now turn things back to Sarah, who will talk more about the Council of State Governments Justice Center, our training and technical assistance, or TTA, provider for the Justice and Mental Health Collaboration Program, known as JMHCP. Sarah?
Thanks, Maria. The Council of State Governments Justice Center is a national, nonpartisan, nonprofit membership association for all three branches of government. Within the Justice Center, we focus on criminal justice policy issues. We combine the power of a membership association representing state officials in all three branches of government with policy and research expertise. We bring people together through our ability to reach federal, state, and local leaders from all the branches of government. We gather people from both sides of the aisle across the country to foster collaboration. We drive the criminal justice field forward through original research, and we build momentum for policy change. We do this through synthesizing and conceptualizing data to help policymakers enact and implement major reforms to address criminal justice challenges, such as mental illness and substance use disorders. We provide expert assistance. We provide on-the-ground training and technical assistance to state and local agencies through the Justice and Mental Health Collaboration Program. We develop research-driven strategies to increase public safety and strengthen communities. We work in areas across the justice system, from law enforcement to diversion to reentry, on mental illness, substance use disorders, employment, education, and other critical topics that touch on the juvenile and adult justice systems. I'm going to turn it back to Maria to talk about the eligibility for the JMHCP grant program.
Great. Thanks, Sarah. We thought it would be really important to begin with eligibility. And the eligible applicants for this grant are units of state, local, and federally recognized Indian tribal governments as determined by the Secretary of the Interior. I'm going to stress this because it's important. Applications will only be accepted if it is jointly administered by a criminal justice or juvenile justice agency and a mental health agency. So it's got to be a partnership, and right from the very beginning, a partnership in the application itself. A criminal or juvenile justice agency is an agency of state or local government or its contracted agency that is responsible for detection, arrest, enforcement, prosecution, defense, adjudication, incarceration, probation, or parole relating to the violation of criminal laws of that state or local government. A mental health agency is an agency of state or local government or its contracted agency that is responsible for mental health services or co-occurring mental health and substance abuse services. A substance abuse agency is considered an eligible applicant if that agency provides services to people with co-occurring mental illness and substance abuse, or what we call CMISA as an acronym. Only one agency is responsible for the submission of the application in grants.gov. This lead agency must be a state agency, unit of local government, or federally recognized Indian tribal government. Under this solicitation, only one application by any particular applicant entity will be considered. Any others must be proposed as subrecipients or subgrantees. For example, the state or unit of local government will need to be the applicant, and the nonprofit entity would be the subrecipient. Next slide. So next we have the overview of the JMHCP, and the focus of the JMHCP is cross-system collaboration to improve responses and outcomes for people with mental illnesses and co-occurring substance abuse who come in contact with the justice system. These service partnerships enhance and increase law enforcement responses to people with mental illnesses and co-occurring substance abuse, which supports the safety of officers and the public in violence reduction. Next, some program-specific information. We know there can be gaps in community-based behavioral health crisis services, which often causes law enforcement to be the de facto first responders to people in mental health crisis. In fact, law enforcement is often called for assistance and responds when no crime has been previously committed. A deficit in mental health crisis services and a lack of effective collaboration between criminal justice and mental health agencies cause disproportionate numbers of people with mental illnesses to be arrested and placed in jails for longer than average stays. It also exposes law enforcement to potentially volatile circumstances. To counter these challenges, the JMHCP promotes officer and public safety through the coordination of system resources for people who are accessing multiple services, including hospital emergency departments, jails, and mental health crisis services. It also counters challenges by cross-discipline training for justice and treatment professionals and communication, collaboration, and the delivery of support services among justice professionals and treatment and related service providers. Next, let's talk about the grant categories. So BJA offers specific grant categories for communities to access federal funding and technical assistance to develop solutions that will help address mental illnesses or CMISA, co-occurring disorders, and the justice system. Each provides a different type of opportunity to applicants. The categories are Category 1, 2, and 3. And Category 1 is a collaborative county approach to reducing the prevalence of individuals with serious mental illnesses in jails, which supports a collaborative planning and implementation process. Category 2 is strategic planning for police and mental health collaboration. This is a competitive grant that focuses on law enforcement interactions with people who have mental illness or co-occurring disorders. And Category 3 is implementation and expansion that invites a focus from anywhere in the justice system and provides changes to do innovative projects to address mental illness or co-occurring mental illness and substance abuse disorders. And Category 3 is our broadest or our widest category, and it can take up projects from anywhere in the criminal justice continuum. Every applicant will need to choose a grant category. It is important to think through which grant category would be most helpful in your jurisdiction in assisting with system coordination between criminal justice, mental health, and substance abuse treatment. So let's begin with Category 1, Collaborative County Approaches. This category supports jurisdictions to reduce the prevalence of individuals with serious mental illness in their jails. Next slide, please. Oh, you got it. Great. Through a two-phase process consisting of planning and implementation, Category 1 grantees will develop a system-wide coordinated approach to safely reduce the prevalence of low-risk individuals with mental illness or co-occurring mental illness and substance abuse in local jails. The work under JMHCP Category 1 closely mirrors the processes recommended through the Stepping Up initiative. In May of 2015, the Council of State Governments Justice Center, the National Association of Counties, and the American Psychiatric Association launched Stepping Up, a national initiative to reduce the number of people with mental illnesses and co-occurring substance use disorders in local criminal justice systems. Stepping Up calls for a paradigm shift to move beyond programs and pilots to scaled impact and measurable reductions in prevalence. Stepping Up is a data-driven cross-systems planning process that guides counties in identifying the scope of the challenge, to bring evidence-based practices to scale, and then to track progress of those initiatives. The data-driven cross-system planning process is guided by a framework of 6 questions and 4 measures that assist counties in working through the planning process. The 6 questions are: is our leadership committed? Do we conduct timely screening and assessments? Do we have baseline data? Have we conducted a comprehensive process analysis and inventory of services? Have we prioritized policy, practice, and funding improvements? And do we track progress? Stepping Up recommends that you collect baseline data on and review the success of your strategies by tracking movement of these 4 key measures. These key measures, again, are to reduce the number of people with mental illness booked into local jails, to shorten the length of stay, to increase connections to care, and to ultimately reduce recidivism. Next slide. Thank you. In addition to the framework, 6 questions, 4 measures document, there are many other free resources available on Stepping Up's website. You can check these out at stepuptogether.org. Some additional resources include things like the Project Coordinator's Handbook that helps a coordinator walk through the Stepping Up planning process, including facilitation notes for running meetings, exercises to do a planning team, and then there's also an online self-assessment tool that a county planning team can walk through together that provides feedback on how each county is doing. Walking through the planning process provides resources as you discover your particular jurisdiction's areas of need. And we encourage you to check out stepuptogether.org, and as your training and technical assistance provider, will tell you more about Stepping Up and how it can complement the goals of your grant project. Okay, so Category 1 and the phases. Phase 1 is the planning phase of the grant, where the grant recipients will receive intensive, technical assistance, or TA, from BJA's National Training and Technical Assistance Provider. Grantees follow a document called the Planning and Implementation Guide, and this document is refined each year to meet the grantee's needs. It utilizes some of the stepping up information I mentioned in the previous slide. The solicitation says within 8 months of receiving final approval of the project's budget from OJP, grantees can spend up to $100,000 during this planning phase to work through the TTA with the TTA provider on the Planning and Implementation Guide. And then the second phase is the actual implementation phase, where grantees begin after BJA's approval of the Planning and Implementation Guide. The grantees can then spend the remaining grant funds on directly related implementation activities. Past grantees have found that the planning phase helps to prioritize where to begin the implementation phase. So Category 1, Phase 1 deliverables. We would like to provide a little bit more about Phase 1, or the planning phase, of the JMHCP Category 1 grant. There are several different options for how you can use your funds, which are: establish a team or utilize a pre-existing team of county leaders, relevant stakeholders, and decision makers from multiple agencies to engage in the planning process. You can also develop a plan to conduct timely screening and assessment for mental illness or co-occurring mental illness and substance use, and for the risk of recidivism. Establish baseline measures that I mentioned before when discussing stepping up, and the measures again are the number of people with mental illness or co-occurring mental illness and substance use booked into jail, their average length of stay, the percentage of people connected to treatment, and their recidivism rates. You can also conduct a comprehensive process analysis and inventory of services to determine existing policies, practices, programs, and treatments that exist and identify service capacity and gaps, as well as evidence-based programs and practices. So Category 1, Phase 1 deliverables. Prioritize policy, practice, and funding improvements and estimate the impact of new strategies. During the deliverables, the grantee will establish a process for tracking the impact of the plan on those 4 key outcome measures. Again, the number of people with mental illness booked into jail, their length of stay, their connections to treatment, and then tracking recidivism. Applicants may consider engaging a research partner or evaluator to ensure outcomes are being evaluated effectively. This phase also includes the design of data integration or data matching systems between jails and community service partners to better understand patterns of people considered high utilizers of multiple systems. Category 1, Priority Considerations. Next slide, please. Thank you. The last thing we want to highlight about Category 1 is that there are 5 priority considerations to be aware of. Priority consideration may be given to jurisdictions able to demonstrate one of more of the following. Please think through whether you will be able to do any of these things before you submit the application. 1 is pass a resolution for stepping up. Note that a template resolution can be found on the website and is linked on the slide above. Or establish a representative planning team or criminal justice coordinating council comprised of key leaders from the justice and behavioral health systems. List can be continued on the next slide. So, Category 1, Priority Considerations. And here you can see this list continues. The 2 final priorities are to have an assigned project coordinator to work across agencies, manage the planning process, and we all wear many hats. It can be important to have someone who is really helping to wrangle these multi-system coordination efforts. Another priority is partnered with a local research organization, university, to assist with local evaluation and data collection or performance measurement. This can be really helpful to grantees and make sure they have the data that they need and a way to show that their efforts are working or impact. Next slide. So we're on to category 2, or strategic planning for police and mental health collaboration. This grant category's objective is to plan new approaches or enhance responses to calls for service for people with mental illnesses, and to effectively use law enforcement and community service providers' time to address the needs. This other key piece to improve safety for civilians and officers when law enforcement responds to people with mental illnesses or co-occurring mental illness and substance use. Upon receiving a grant, and with the intensive training and technical assistance provided by BJA's National Training and Technical Assistance Provider, the planning process can include many activities. Next slide. So you may be asking, what is police mental health collaboration, or PMHC, or what is a PMHC framework in general? And it is a way to break down the development of a PMHC for a jurisdiction, or that whole collaboration process. BJA recently released this framework document, and I encourage you to read through it and be thinking about applying for this grant category as you read through it. It involves 6 questions to examine a PMHC, or a police mental health collaboration. And the 6 questions involve things like, is our leadership committed? Do we have clear policies and procedures to respond to people who have mental health needs? And do we provide staff with quality mental health and stabilization training? Does the community have a full array of mental health services and supports for people who have mental health needs? Do we collect and analyze data to measure the PMHC against the 4 key outcomes? Do we have a formal and ongoing process for reviewing and improving performance? And as you can see, this takes this complex topic and breaks it down into leadership protocols, training, resources, and service connections, data, and improving performance. This slide sort of captures the optimum of what we're trying to accomplish, and we understand that that takes a while, and it also requires a lot of technical assistance. Oftentimes, jurisdictions do need that extra help, and that is part of what JMHCP can help jurisdictions accomplish. Next slide. So category 2, deliverables. For this planning grant category, the deliverables as a part of this grant category that I'll be going over in the next few slides. The first 2 deliverables here are 1, to establish an interagency work group, including law enforcement, behavioral health, and all other major stakeholders such as 911, and including dispatch, hospitals, courts, and corrections. This really reflects the goal of JMHCP grant program of justice and behavioral health collaboration and the leadership buy-in piece of the PMHC. And you can see number 2 is to designate a law enforcement agency project coordinator in a position of authority to review data on performance and adherence to policies and procedures, ensure day-to-day operations are in line with the PMHC mission, and coordinate outreach and engagement with other partners. We have found that it's critical to have someone that's guiding this process to develop a PMHC. Next slide. So we'll continue with these deliverables, and number 3 is to review and revise as needed existing protocols to respond to people who have mental illness or co-occurring mental illness and substance use, including interagency agreements, screening and guidance for mental health calls for service, and information sharing. These are all key areas through this planning process. Many sites will be able to begin revising protocols and setting goals for future areas that they would like to work on further or improve and grow. And number 4 is to review and revise as needed existing officer mental health training to manage or diffuse encounters with people exhibiting mental illness and co-occurring mental illness and substance use. This includes call takers, dispatch training, and provides options to inform and aid responding officers through the use of such options, such as premise alert forms. These are forms that can be filed with local law enforcement agencies so they have a better understanding of who is in their community that might have special mental health needs. And training is something that is a real focus for JMHCP. It is critical to give officers and others the information they need to help identify people with mental illnesses and make these critical connections. We'll continue with Category 2 deliverables. Number 5 is to assess existing behavioral health care resources such as crisis hotlines, mobile outreach, crisis facilities, outpatient treatment, and more. To identify gaps in services and prioritize behavioral health resources for PMHC strategies. Knowing the gaps in the system and services that are available is a key part to making a PMHC successful and gives jurisdictions the ability to prioritize behavioral health resources. And number 6 is to assess the ability to track mental health-related calls for service and dispositions. For example, repeat calls for the same individual, duration of those calls for service, and to develop additional capacity to analyze and track these calls. Tracking mental health-related calls will provide key information to assist in utilizing response resources in the most productive way. And we'll continue on with Category 2 deliverables with number 7. And this is to design data integration and data matching systems between law enforcement and community service providers to better understand patterns of people considered high utilizers of multiple services such as healthcare, housing, and the use of EMS, or emergency management services, to improve and increase coordination, response, and community capacity. Using data to analyze the patterns of these high utilizers will assist the PMHC in creating specialized response strategies that will maximize law enforcement, EMS, and community provider time and resources while maintaining officer and public safety. This has been a key focus for many past grantees. Number 8 on the deliverables will be to work with our training and technical assistance team to organize at least 2 collaborative project partners, 1 law enforcement and 1 mental health partner representative, to travel and engage in a peer-to-peer learning with 1 of 10 of BJA's established law enforcement mental health collaboration learning sites as part of the strategic planning process. If you're not familiar with the law enforcement mental health learning sites, I strongly encourage you to look them up. They are fantastic resources and they are national. They are all across the country. I've been to visit several of them, and I can tell you I learned something new each time and at every site. Each one has something very special to offer, and depending on what your learning objectives are, each site can help you. Number 9, develop a process for reviewing and improving performance data to promote additional PMHC capacity and long-term sustainability. Sustainability is another key focus of JMHCP, and part of the planning process involves identifying potential resources to support the implementation of the planned PMHC project. We want to make sure every grantee is getting the information they need to sustain their program after the grant period ends. Category 3. This is our implementation and expansion category, and this third JMHCP grant category is focused on a wide variety or array of projects spanning the entire criminal justice system. And it is our biggest category, and most programs that apply in this category do have a fairly well-established program, and they're looking to expand or enhance in some way. Next slide, please. The overall goal of this category is to increase public safety and reduce recidivism among high-risk people with mental illness and co-occurring mental illness and substance use. This grant category 3 grants, can support initiatives across the justice system, just as I mentioned. There can be programs in law enforcement, in prosecution, in the courts or court-based programs, pretrial, corrections, and or parole and probation initiatives. Also, direct services. And grant funds can be used to support a combination of these allowable uses, which I just described, and I will continue to describe in the next few slides, or they can be concentrated in one specific category. This is a really great, I think, really creative category because we get to see all of the innovative ideas that all these programs are coming up with across the country in order to address the problems in their own community. And there's a chance here to be creative in what you propose and think and how you can have the greatest impact across the justice system for people with mental illness. Next slide. So a little bit about the target population for Category 3. There are some additional pieces in this solicitation about the target population for Category 3 that we want to bring to your attention. Current research points toward the Risk-Need-Responsivity, or R&R model, for how corrections and judicial authorities should be identifying and prioritizing individuals to receive appropriate interventions. When prioritizing people with behavioral health needs in the justice system for scarce programming and treatment resources, priority should be given to those at higher risk for recidivism and higher criminogenic need as determined by validated actuarial risk and need assessment. Use of or implementation of a criminogenic risk and needs assessment is very common among our JMHCP grantees. Really think through how you can target the people with the highest criminogenic needs to make sure you're getting the most out of your grant funds. So target population as per the 21st Century Cures Act, and as indicated in the 21st Century Cures Act that provided funding for JMHCP grant funds, most use support a target population that includes adults or juveniles who have been diagnosed as having a mental illness or co-occurring mental illness and substance use, or manifest obvious signs of mental illness or co-occurring mental illness and substance use during arrest or confinement or before court. Having been unanimously approved for participation in a program funded under this solicitation as appropriate, the relevant prosecuting attorney is involved, the defense attorney, probation, corrections, the corrections official, judge, and a representative from the relevant mental health agency, as appropriate, depending on the type of program, and having been determined by each of these relevant people to not pose a risk of violence to any person in the program or to the public, and have not been charged with or convicted of any sex offense or any offense related to the sexual exploitation of children or murder or assault with intent to commit murder. So that is a little bit more detail about the target population for Category 3. So Category 3, court-based programs. For court-based programs, in addition to the requirements listed above in determining a defendant's eligibility for participation in a program funded under this solicitation, the relevant prosecuting attorney, defense attorney, probation or corrections official, judge, and mental health or substance use agency representative shall take into account the following considerations. 1, whether the participation of the defendant in the program would pose a substantial risk of violence to the community. 2, the criminal history of the defendant and the nature and severity of the offense for which the defendant is charged. 3, the views of any relevant victims to the offense. 4, the extent to which the defendant would benefit from the participation in the program. 5, the extent to which the community would realize cost savings because of the defendant's participation in the program. And 6, whether the defendant satisfies the eligibility criteria for program participation unanimously established by the relevant prosecuting attorney, defense attorney, probation or corrections official, judge, and mental health or substance abuse agency representative. That's a lot to consider. All programs should have clear and transparent eligibility requirements and accept any people who meet those requirements after they have been screened for criminogenic risk and mental health need. The continuum of diversion interventions. As I mentioned earlier, grant funds may be used to support a combination of allowable use categories. This graphic shows some of the options for pre-booking and post-booking interventions that can be funded under JMHCP, from law enforcement, initial contact, to jails, to courts, to pretrial services, to specialty courts, to reentry from jail or prison, or probation and parole initiatives. We have seen a lot of innovation from grantees over the years and how they can create systems change using JMHCP grant funds. This graphic also highlights that at any point in the criminal justice system, it is important to connect people with who have mental illnesses or co-occurring mental illness and substance use with the community-based continuum of treatment available, along with support services and housing. Really think through your criminal justice system and the places or those intercepts that you can have the greatest impact through applying for these grant funds. Category 3 grant phases. Just like Category 1, the Category 3 grants have 2 phases. Phase 1 is a planning phase where awardees receive technical assistance from BJA's National Training and Technical Assistance Provider and follow and document the steps laid out in the Category 3 Planning and Implementation Guide. This is done after receiving a grant award and within 6 months of receiving final approval from the project's budget through OJP. During Phase 1, grantees can spend up to $150,000 to support their planning efforts. Phase 2 comes after completion and BJA approval of the Planning and Implementation Guide. This is where the remaining grant funds may be used to support allowable activities and deliverables. So next we'll get into the deliverables of Category 3, Phase 3 awards. A little bit more information on these specific allowable activities here I'll talk about for Phase 2 in the implementation phase and as outlined in the solicitation. So under Category 3 deliverables in Phase 3, grant funds can be used for training for criminal justice, mental health, and substance misuse treatment personnel. This can include specialized training for law enforcement, staff training targeted at mental health and criminogenic needs, cross-system training of criminal justice personnel, including law enforcement, corrections-based staff, courts personnel, community supervision personnel, and community-based mental health and substance abuse providers. It can also be used for screening, assessment, and information sharing. A criminogenic risk needs assessment must be completed for all program participants, and also appropriate risk need assessment in conjunction with behavioral health needs assessments inform the types of services to provide and the intensity of supervision for this population. And also, coordinating the use of these assessments is often a challenge, but we have some good examples in online collaborative comprehensive case planning tools, and your training and technical assistance provider can also support you in these efforts. Another allowable use is developing specialized caseloads for people on community supervision with more significant mental health needs and higher risk of reoffending. For law enforcement, this could include implementing or enhancing a crisis or receiving center for people who are in custody of law enforcement to assess for suicide risk and for mental illness or co-occurring mental illness and substance use treatment needs. Another allowable use is case management. And again, another use is information sharing within and across criminal justice and behavioral health treatment agencies, either to make eligibility determinations, to ensure direct connections to treatment services in the community. And here, an example for law enforcement, this could include developing or enhancing computerized information systems to provide timely information to law enforcement, which can foster the systematic analysis of incidents involving people with mental illness or co-occurring mental illness and substance use disorders. Category 3, priority considerations. There are 2 priority considerations for the JMHCP Category 3. Next slide, please. Thank you. The first is program evaluation, and program evaluation is critical to the effectiveness and utility of JMHCP programs, as evaluation not only determines which programs are most effective for which populations, but also contributes towards the expansion of knowledge base of what programs have the highest likelihood for success in lowering recidivism and improving public health outcomes. BJA strongly urges applicants to consider a partnership with a local research organization or university that can objectively assist with data collection, performance measurement, and local evaluation. We've seen a lot of success with these types of partnerships in recent years and look forward to continuing to build the knowledge base and to help highlight the great work of our JMHCP grantees. And we know that you all do excellent work. And number 2 is the provision of services for female offenders. Consistent with the authorizing legislation, priority will be given to applications that promote effective strategies for the identification and treatment of female offenders with mental illness and co-occurring mental illness and substance use. We have also seen many grantees successfully provide evidence-based, gender-responsive services to women involved at various points of intercept within the justice system, and look forward to seeing more of this continued focus on this specific population and applicant pool. So now I'll briefly turn it back to Sarah, who will introduce you to our next topic.
Thanks, Maria. So Maria is going to go over some additional award information, and then I will be speaking for Nikisha Love on the budget review and criteria section, since she cannot join us today. We also already have some great questions in, but feel free to continue to chat them into the chat box as they come up. I will turn it back to Maria.
All right, great. Thanks, Sarah. So I'm going to continue talking a little bit about evidence-based programs or practices, which is a strong emphasis for the Office of Justice Programs. This includes the use of data and evidence to inform policy making and program development. OJP is committed to improving quantity and quality of evidence that OJP generates, integrating evidence into programs, practice, and policy decisions within the field, and improving the translation of evidence into practice in criminal justice, juvenile justice, and crime victim services. The JMHCP grant program has helped advance the field through the use of evidence, program, and practices. It's exciting for me to see everything that is being done with these funds across the country each year, and I get very excited when all the applications are in and I get to read all of the programs. They're usually very innovative, and they really help to move the policy needle forward. So the next slide. Above, we discussed how program evaluation was a priority consideration for JMHCP earlier. The Department of Justice has prioritized the use of evidence-based programming and deems it critical to continue to build and expand the evidence informing criminal and juvenile justice programs to reach the highest level of rigor possible. The Office of Justice Programs may conduct or support an evaluation of the programs and the activities funded under the solicitation. Next slide. OJP will, as appropriate, give priority consideration in award decision-making to applications that propose projects that directly benefit federally designated qualified opportunity zones In order to assist OJP in considering this factor, applicants should include information in the application that specifies how the project will generate information about enhancing public safety in these specified zones. For resources on the qualified opportunity zones and to learn more about it, and for a current list of designated zones, see the U.S. Department and the Treasury's resource web page, accessible at the link provided on the slide. So please refer to that link and read more about it. And the next slide is where I really want to pay attention to this slide. It's really important because of the exciting information about the award amounts for all three categories this year. This will help us to think about how we can potentially use the funds. Unfortunately, my colleague Nikisha is not with us today, but we would like to take any questions you may have about these awards and the amounts. And if we don't have answers today, please write them in the chat box. We'll continue to gather that information for you and get back to you at a later date. So now I'd like to turn it back over to Sarah from the Justice Center.
Thanks so much, Maria. And I'm going to talk a little bit about the budget and review criteria. We were hoping to have Nikisha here today, but she's unavailable, so I will try to cover the section. So for the budget information, so for applicants for categories 1 and 3, you must explain the inability to fund the collaborative program adequately without federal assistance. Specify how the federal support will be used to supplement, not supplant, state, local, Indian tribe, or tribal organization sources of funding that would otherwise be available, including third-party billing resources that are already covered. Outline plans for obtaining necessary support to continue the proposed collaboration following the federal award period. So budget requirements. For applicants, you must include the amount and source of a matching fund, and this is a really critical piece because this has often been an issue for sites. This key piece can be slow down the budget approval process overall if you are to receive the award as well. For categories 1 and 3, applicants must set aside an adequate amount of funding to implement a data collection plan. For category 1, with the structured planning phase, there is up to $100,000 of the total grant award to complete the planning and implementation guide within 8 months of the budget approval. For category 3, there's also a structured planning phase to complete within the first 6 months of receiving the budget approval for up to $150,000. Program budget approval and coordination with technical assistance coordinators are required to complete and submit a planning and implementation guide. So cost sharing and match requirements, which these are often some of the biggest questions when people are putting these together. So in the OJP financial guide, there's a section on in-kind services for additional information. I really recommend that everybody who has any questions on budgets, the OJP financial guide is critical to answer your questions, and make sure to go there first. Federal funds awarded under this solicitation may not cover more than 80% of the total cost of the project period for year 1 and year 2, 60% of the total cost for the project year 3. An applicant must identify the source for the 20% non-federal portion of the total project's cost for years 1 and 2 and how the match funds will be used. In addition, applicants in Category 3 proposing a third project year must identify the source of the 40% non-federal portion of year 3 costs and how the match funds will be used. If a successful applicant's proposed match exceeds the required match amount, OJP approves the budget, the total match amount is incorporated into the approved budget and becomes mandatory and subject to audit. Recipients may satisfy this match requirement with either cash or in-kind services. See the DOJ Financial Guide for more examples of in-kind services. Please note that OJP does not typically approve pre-agreement costs. An applicant must request and attain prior written approval for a cost like this. Indian tribes and tribal organizations that otherwise are eligible for an award may be able to apply certain types of funds received from the federal government, for example, certain funds received under the Indian Self-Determination Contract, to satisfy all or part of the non-federal match. Applications should include some certain information. The pieces that BJA has designated critical is the program narrative, the budget detail worksheet, and the budget narrative. Before you submit the application, please look at this entire list of additional items to make sure that you have submitted everything that is required by the grant. So this talks about the review criteria. BJA utilizes a peer review process for the selections of award, and there are 5 categories. Description of the issue, which is 15%, project design and implementation, which is 40%, capabilities and competencies, which is 30%, a plan for data collecting and based on the performance measures is 5%, and then the budget, which we have been talking about, is 10%. To support applicants, BJA wanted to provide some additional tips, which the program offices put together for this PowerPoint presentations, to try to help prevent any issues that may delay access to the funds once the grants are awarded. Please keep this in mind as you put together your application, because they're all really important points that they have often seen hold people up from actually getting the funds. So the legal name, address, or tax EIN should be for the legal entity that will be receiving and managing the funds. Please carefully review and follow the guidance from the solicitation for additional information on this. The SAM or SAM registration, this is used by OJP and BJA from sam.gov to confirm active registration and to verify the legal name and address. If the SAM registration is not active at the time, they'll conduct a search, and if the search does not match the application, a hold will be placed on the funds. The authorized representative, you want to make sure that whoever is listed to sign and accept the agreements for the legal entity applying for this. In general, this is the highest elected official, a mayor, a board of supervisors, a tribal head, or an appointed chief administrative official, county administrator, for example. OJP uses the internet to confirm this prior to the award. For funding, the total federal request entered and should match the total federal request in the application budget for the entire project period. Budget, subaward versus procurement contracts. You should pay careful attention to the guidance in the solicitation to properly categorize your costs, because this is a common error. Here are the final 5 recommendations from the programs office at BJA. For budget and match, refer to the cost sharing or match requirement, cash or in kind. All match cost items must meet the same allowability guidelines as federal cost items. If you exceed the required minimum match amount, any amount over will be subject to audit, which means that you have to comply with whatever was submitted. Application attachments in general, make sure you just know exactly what it says is needed for the application for this grant, and double check it, use the checklist as we described earlier. Application attachments and disclosure pending, note this is required for all applications, whether you have duplications to declare or not. And please use the legal names listed in order to do this. Applications and attachments for research and evaluations and independence and integrity. If you are proposing to use grant funds to pay an outside evaluator or research partner, this attachment is required, and that is a priority in several grant categories, so make sure that you take note of that. For the program narrative, opioid abuse reduction, all projects must be able to address this issue, and this should be reflected in the program narrative per the solicitation guidance. How to apply. So basically these links are very important when you're putting together your application. You want to make sure that you're registered on grants.gov. There are instructions below on how to register. And if you need technical assistance for it, there's several hotline numbers that you can call, and they operate 24 hours a day, 7 days a week, except for federal holidays, so they are here to support you. So the deadline is June 25th, 2019 at 11:59 p.m. Eastern. Again, applicants must register prior to that. Make sure your registration goes through, so we recommend registering early. OJP encourages all applicants to read the information provided on this slide with a link and think through how to apply and making sure you're following all of the guidelines to make sure you're doing everything correct. You can also contact for technical assistance with applications. The numbers and emails provided. Grants.gov has a hotline, 24 hours, 7 days a week. For assistance on technical issues beyond the applicant's control, you need to contact the National Criminal Justice Reference Service Response Center. There's a number, there's also an email, there's a web chat you can use, and they operate from 10 to 6 Eastern Time, Monday through Friday. So now we have time for questions and answers. And actually, looking at the time, we do not have that much time for questions and answers, but we will take a few questions, and then we know there was a lot more questions in the chat box that we haven't answered, so we'll do our best to write up answers and send those out to those on the webinar. The webinar is going to be recorded and put online as well, so everyone will have access to the webinar, including the slide deck. Okay, so the first question is there a cap on the percent of the grant that can be allocated to subgrantees? Maria, do you have an answer to that question?
Can you hear me, Sarah? I'm not on mute, right?
Oh, now I can hear you, yep.
Okay. So the amount that has to go to subgrantees, there is somewhat of a cap in that it has to be approved. I think if it's over $150,000, there is, of course, budget caps, contract caps. If you have a contract, per hour, there is a cap. I would urge you to go to that OJP financial guide, and you can even just do a control find on contractual rates, and it is in there. There is a new financial, the reason I'm not going to quote a figure is because the financial guide just changed, and it's been updated, and I just want to make sure that you get the right amount directly per the financial guide. And I know that we have a link in one of these slides for the OJP financial guide. So I would suggest you go there to get that dollar amount. And you can always get it approved from your grants manager or put it in an email, and we'll make sure to get you an answer. But I know it's in the financial guide.
Great, thank you, Maria, and certainly a really important resource for anyone applying. Go to the financial guide and look at the information. It's super helpful. Can you clarify if low risk referred to in the Category 1 objective is risk for recidivism?
So the low risk is the risk for recidivism, and that's the target population for Category 1, opposed to Category 3, which is these are high-risk folks, and that's per a validated screening and assessment tool.
Great, thank you, Maria. The next question, can costs for training like CIT training be included in Category 2?
Yes, certainly.
Great. The next person has a question, and they are wondering if they are a county agency, are they able to submit the application, or are they able to submit an application themselves?
Yes, but they must partner. Remember, the requirement of this program is collaboration. So the county can submit the application. We only want an application from one organization, of course, but they've got to show partnership with their behavioral health authority, either through an MOU, an actual agreement of activities, not just a support letter. It's got to be an actual partnership, and you've got to be able to demonstrate that.
Great, and that's actually a theme throughout the question. So one of the questions for Category 3 specifically was also, does it have to be a justice partner submitting? It could be a justice partner, a mental health agency, a form of state, local, or tribal government, and
right.
Other partners are often included. So if it's a homeless services provider, if it's a fire emergency medical services, it could be supported employment. Other partners are certainly welcome, but the key part is making sure that the mental health and the criminal justice partner are a part of this process. Okay, so looking at the time, I'm going to head towards some of the additional resources, and we will follow up with the additional answers to the questions. So these resources are things that we discussed on this webinar. There's a link to the Police Mental Health Collaboration Framework and the PMHC Toolkit. There's a link to the documents from Stepping Up on the 6 questions, the Collaborative Comprehensive Case Planning Tool, and the Criminogenic Risk and Behavioral Health Needs Framework. So all of these can be helpful depending on the category that you are applying to. Here is contact information for myself, Maria, and Nikisha and Tracy, who are on the program side for Justice and Mental Health Collaboration Program. If you email any of us, we're happy to make sure the question gets to the right person, so feel free. We're happy to support, and again, we'll answer the additional questions via email. So thank you so much for taking the time to speak with us today. We hope that you all apply for the Justice and Mental Health Collaboration Program grants. And thank you, Maria, for your help on this webinar.
Thank you all. Thank you, Sarah.
All right, have a good afternoon.